So we finally in the topic of how to set up the Nuclear Medicine Center, how to build, how to create the Theranostics Center. Well, usually we are speaking only about patients, about clinicians, about radiopharmaceuticals, but it's very interesting to know what it is behind the scene, what is behind the curtain. And our idea, the idea of our symposium is to show and to commune three different areas, three different pillars. First, clinical part. It's all about trials, it's all about patients. Technological, it's all about radiopharmacy, it's all about physics, it's all about, for example, artificial intelligence and other important technologies. And I will speak about infrastructure because the contemporary, the modern theranostics, it's not possible without the building, without technologies, without cyclotrons, without laboratories, without waste management and regulatory. Well, when we start to discuss this topic with our scientific committee in Oncidium, we focused on many problems, but here I would like to show maybe the major points. And the major points, from my point of view, is human resources. It's one of the major resources. Regulatory, because in all countries, bureaucracy and regulatory, it's always the maze. And also finance and management, because you have to achieve somehow the final result, and you cannot do it without money. Well, here you can see the roadmap from raw idea to the patient. And the very interesting point that the investment phase, the financement start here. So you have to spend 1 year somehow to achieve this point. And before you can create a nice idea of your future clinical center, when you have to create a medical concept, and it is very important to deal with a multidisciplinary team. It's very important to have good friends, to work with some agency like International Atomic Energy, because at this stage, International Atomic Agency can support you for free. When the regulatory and the requirements base is ready, you go to the business and the finance plan. When the finance plan is ready, it's the investment phase. And the investment phase is very important for the state institution and for the private institution. Well, when the investment phase done and when all shareholders agreement and other agreements signed, you only get access to the budget of the project. Well, from this stage, most of lines in your Gantt diagram start going in parallel. Well, let's focus on design and construction, because even if you are a doctor or if you are, for example, administration or medical administration from Ministry of Health, you should know about design sometimes, you should know about construction. And today the contemporary project design starts from very well performed conceptual phase. And this conceptual phase usually takes 4 to 5 to 6 months to perform. And so we are using, for example, building information modeling systems to create, to prototype how it will be, how it will work in the future. And please don't forget about the other phases of construction, about the facility management and about the commissioning, because usually people thinking that if they are buying the equipment, somebody has to do everything as a turnkey. It's not true. You have to foresee your own structure or your own forces to manage it somehow, to do a project management in this phase. Well, in parallel, you have to foresee the supply chain because you have to be sure that all radiopharmaceuticals, all precursors and other stuff will be well supplied in the future. You have to foresee human resource program or human resource project since the beginning, since the conceptual phase, because your team should get enough knowledge and enough expertise before the project will start, before the construction will start. Well, regulatory project also, it's a kind of multi-phase project started in parallel with design, and don't forget about promotion. You have to speak about your project, about your clinic from the design phase, not when the red linear will be cut and not when the door open. People should know about you 1 or 2 years before and should be ready for the opening of the clinics. Well, a couple of words about ingredients of this pie. Well, BIM design, human resources, engineering, conceptual design, communications, operation management, IT integration, quality system, and facility management. A couple of words about pains and risks. The project could be derailed and rejected, and I faced many times the situation then projects were rejected because of different reasons. You see, like Babel Tower, regulatory risks, lack of competition, lack of competence, and lack of competence on administration level. Why we created this summit, it's also to give you more understanding give you more understanding about all parts of this project. Supply issues and the financing. Well, yellow submarine is because it's too late to do some changes if you start your radiopharmacy or nuclear medicine center. So you have to foresee before all principles of service equipment, of management, and supplying human resources. Thank you for your time. Keep dreaming, and let's discussion start.